Another opening for communication, again at Minnesota, but I'm sure a lot of other places, is the bone marrow transplant programs more and more are combined pediatric adult bone marrow transplant programs, so that the faculties are speaking to each other, not just about the acute problems of transplantation, but all the problems that these children might have, so that our internists who are our hematologists, oncologists, transplanters at our place are getting more and more knowledgeable about kids and their needs, and certainly becoming more and more aware of having seen those kids transplanted, when that's the situation, as they mature and what their problems are. And I suspect that those members of our faculty are going to be particularly gifted at making this kind of transition.
The unique situation of where you have a pediatric and an adult transplant center together, working very closely together, is that the transition of the patient post-bone marrow transplant actually is more natural, because it's in the same group. You usually have the same data managers, you've got the same information systems. The disadvantage of working in pure children's hospitals, I mean, there's a lot of advantages to that, but the disadvantage is that lack of communication. And I think that centers like the one in Minnesota really for bone marrow transplant actually are an ideal setting for good long-term follow-up.
We noted in introducing you that you're the executive director of the Center for both Cancer and Blood Disorders. I know you've had some real concern about the same kind of transition of children who used to die regularly, generally of infections and central nervous system disorders, who are now surviving well into their 5th and 6th decade. And of course, I'm talking about sickle cell patients. Any thoughts about the transition of our sickle children to adult care that we ought to be thinking about? Are they any different than the concepts that you outlined for the cancer patient?
No, I think, unfortunately, that's another patient population that is struggling with the transition of pediatric care to adult care. And again, the reason why the problem exists now is because we've been successful at treating these patients and at least preventing them from dying at an early age. In Washington, D.C., we're now actually we're working very closely together with Howard University, which is around the corner from Children's National Medical Center, to see whether we can develop that transition. It is a real problem, and the problem with sickle cell is as big as it is with cancer. The only difference, to some extent, is that the patients with sickle cell continue to have sickle cell and require treatment as well as follow-up, and the cancer patients, should not require more treatment. But it highlights the same challenge: a smooth transition of a disease that reveals itself in a child, and actually is a disease that continues throughout life. And again, I would hope that people that are boarded both in pediatrics and in internal medicine, and maybe we should train some of these people after their training in internal medicine and pediatrics in hematology, because they would be able to see both kind of patients. And I would imagine that in an institution like yours, where adult and pediatrics are closer together, that transition would be smoother than in freestanding children's hospitals.
I would comment on the sickle situation is that what the pediatricians are most concerned about in sickling children is significantly different than what adult adult physicians are involved in. Your problems in pediatrics and sickle are to try to prevent cognitive damage, brain damage, and do all the appropriate studies that you now do with Dopplers and so on to see who should have exchange transfusions, or at least transfusions. By the time we have the adults, it's too late. But many of us are also aware that even though a child may not have had overt neurologic problems, we do see strokes and this kind of thing, and we're not paying enough attention to what you folk know about in assessing circulation of the brain. in the same way you don't see probably much, if any, pulmonary hypertension being a problem, that is becoming a major problem in adults after the age of 40, which of course we didn't 20, 30 years ago. We weren't dealing with that many patients. We now understand something about that pulmonary hypertension. It takes a long period of time of having intravascular hemolysis with nitric oxide sumping, and we in the adult field are at least beginning to think about how to deal with that nitric oxide deficit. We need to teach perhaps the pediatricians to be thinking a bit more about that at an earlier stage before we get irreversible damage to lungs in these patients. So this is a kind of crosstalk that's required, and so I'm glad you spent some time really thinking about this, and by thinking about it, perhaps we will come up with some ways of facilitating this kind of transition.
I think it's I mean, to me, it's been very exciting to have these discussions with internists and our adult colleagues. In Washington, we're very fortunate. Mark Gladwin is there, and actually we are now doing studies in children to look at pulmonary hypertension. And unfortunately, there's at very early age, there are children that have pulmonary hypertension. One of the biggest joys for me to be on this board is actually this interaction between adult specialists and specialists that take care of children. And I think many on the board think of ourselves as oncologists, why to treat children or breast cancer or what have you, rather than pediatricians who do oncology. And I think this interaction, in my own professional life, I've always been part of a cancer center. Now in Washington, I'm also part of the hematology community, and very enjoyable.
I'll return the compliment and say that we at HemOnc today feel extraordinarily fortunate to have both you and Larry Boxer representing the interests of child health. And thanks for participating today.
Thanks very much.
Thank you for watching this video from HemOnc Today. Keep up with all our new videos by visiting the HemOnc Today YouTube channel, or go to our website at hemonctoday.com.